Hello, everyone. We will be starting our webinar in 2 minutes. Apologize for that. Thank you. Again, hello, everyone. This is Dr. John Uchema, the incident manager for WHO African countries. I will be moderating this last day, 5 days webinar series on dengue outbreak control in the African regions. Today is our last day, as I said. We'll be discussing on risk communication and community engagement. This is one of the key topics we had after going through all other messages. Let's just remind everyone on some that's there, including the training, should adhere to the code of conduct to prevent harassment, including sexual harassment at WHO events. In terms of questions and discussion, we will be using Q&A to ask question related to the today's subject, related to risk communication and community engagement of dengue management. If you have any technical issue, logistics, IT related, please use the chat and don't include question in the chat just to remind people. You can also use the chat to introduce yourself, your name, affiliations, and country using chat. In terms of interpretation, we'll be having English, French, and Portuguese language are available. If you want to shift from one language to another, please just click mute original audio and we will be able to shift to language. Today, we'll be having two presenters who will be presenting in French. So you will have to shift from English to French using this icon. In terms of live transcription are available. You can show it up or you can hide it, clicking on show or hide caption if needed. This session is being recorded and we take your attendance as consent to be recorded. Recording will be shared after the session. Session material, including session recording, will be emailed to participants in the day following the webinar. This is why it's important to properly register when you are getting to giving your emails. We would like also to take this opportunity to remind that you will be receiving an email to give your feedback, improving business. So we'll be happy to receive your feedback that is available for us. Agenda is presented like follow. We'll be having a quick introduction in remarks from Dr. Fiona, who is the program area manager for emergency response at WHO Afro. And then the first presentation will be given by Dr. Ibrahim Mamadou, Dengue Operational Plan developed by WHO Afro. The next one will be a communication for behavioral change by Dr. Temi Allen, and Dr. Aziz Amina will be discussing with us experience of Gambia in county risk communication and community engagement. Next, it will be Cote d'Ivoire with Dr. Diabate Kone, who will be sharing experience on risk communication and community engagement platform for dengue in Cote d'Ivoire. And the last presentation will be coming from Dr. Watson Rodrigue for Burkina Faso, sharing experience on risk communication with Burkina Faso. We'll have a Q&A session and then closing remark. Thank you so much. I will be giving now the floor to Dr. Fiona Braka and Dr. Patrick Ramadan. Over to you.
Thank you, moderator, Dr. John. It seems Dr. Fiona is engaged in some other activities, so I'll be able to deliver a few remarks on her behalf. Good morning, everyone. Welcome for this.
You can open your video, Dr. Patrick. Sorry for that.
Yes, it's open.
Okay, thank you.
Can you confirm that you can see me?
I can see you. I will be asking everyone to close the camera, so we'll be giving just opportunity to who is speaking. If Alain Diabate can close the camera. Thank you so much. Go ahead, Dr. Patrick.
Okay, thank you very much, Dr. John, the moderator for today's session. And ladies and gentlemen, welcome to this very, very important webinar. I would like to thank everybody who made time to attend the entire series from the first day we started to today, the last day. Thank you very much. And dengue is a very critical topic for us now in the WHO African region. And as you have gone through in the last few days, it's now posing a serious public health challenge for which we need to respond, and we need collaborative and innovative approaches to be able to respond effectively. Now, in addressing the response to dengue outbreak, it's crucial to acknowledge that dengue, which initially wasn't so much of a public health problem in our region, because we used to have more transmission in the tropical areas in the Asia and Latin America. In the last few years, we have seen a rapidly increasing incidence of dengue within our region. This is largely being driven by things like urbanization, population movement, climate change, which is really favoring the multiplication of the vector, and to some extent, inadequate vector management measures. And I'm quite sure you discussed extensively the integrated vector management during that session. So the other thing is that as we have seen dengue outbreaks, when they occur, they are occurring concurrently with other infectious disease outbreaks, and therefore it is greatly stretching the health system's capacity we have, and therefore we have to be quite agile in our response. We have to be very, very adaptive, and we have to be targeted to be able to prevent this from further spreading and further compounding the challenges of multiple public health emergencies that we're dealing with. Today's session focuses on risk communication and community engagement, which is a very, very vital component of our public health response measures because it puts the communities at the center of the response. And therefore, we have to all work together to empower communities to be able to understand the risks associated with dengue transmission, to be able to adopt preventive measures and to actively participate in control strategies. And more importantly, it has to foster community ownership and community resilience in combating this emerging disease. So this is a very important session, and we hope that we can be able to harness the knowledge that will be shared. Lastly, I would like to thank the Dengue IMST led by the incident leader, Dr. Dorothy, and the incident manager, Dr. John, for working tirelessly to put this series of webinars together. I would like also to thank the entire IMST membership at the regional and HQ, the very, very diverse and rich panel of experts that was put together to share their knowledge over the last few days, and also to thank you, the participants who have devoted your time to attend this. I am quite sure that after this, we will have acquired a very rich set of knowledge that can help us to prevent, to effectively respond, and to be better equipped to manage cases of dengue within our region. So I thank you very much, and I wish you, on behalf of Dr. Fiona, a very, very fruitful deliberation, and we hope we can put into action and practice what we have learned in the last 4 days and what we'll learn today. Thank you very much, and have a nice deliberation.
Thank you so much, Dr. Patrick Ramadan, on behalf of Dr. Fiona, for your opening remarks, and this is really well noted. And thank you for the support we received from leadership on conducting this webinar, who include all 47 countries within Africa, even beyond. Thank you so much again. So let's move quickly to the first presenter. It will be Dr. Ibrahim Mamadou, who will be presenting dengue operational plan. As we discussed, it's really important to have a plan. We discussed about risk mapping, we discussed about epidemiology, the burden. Now it's really critical to have a plan. And Dr. Ibrahim Mamadou will be helping us to go through. Dr. Ibrahim Mamadou, you have 10 minutes for that. Thank you so much. Over to you. Open your video, please, Dr. Mamadou.
Thank you, Dr. John, and thank you, Dr. Patrick, on behalf of Dr. Fiona, for a very good welcome. Want to confirm that my screen could be seen.
We can see your screen and it's perfect. Please proceed.
Okay, so thank you. We are going to be talking about the operational plan, and apologies, this presentation was originally planned for yesterday. So as we all are aware, the globe is facing a very massive outbreak of dengue, and planning and proper preparation is key to being able to mount an effective response. We come to the operational plan for Afro Regional Office. This plan has been in the making from late last year into the first month of this year. Background to the planning process. First of all, the objective of the OAP for dengue in the African region is to provide clear, actionable, and evidence-based strategies to combat the disease. This plan is important, of course, because it offers a standardized and best practice approach to managing dengue outbreaks, especially that all countries in the region must be able to respond effectively and consistently. So what was the process of creating this plan? And this is by no means exhaustive. We, of course, you've heard from the first day, started assessing the region through the risk categorization of countries. And all countries in the 47 member states fall in one category or other, from tier 1 to tier 3. We then, as entire region, did an assessment of the gaps in pillars, including in WCO plans. Country needs were compiled, including from countries that are already in outbreak and countries that have contingency plans and other documents that show where weaknesses exist, including assessments, including for even other diseases. Many of the member states would agree that they have received a readiness assessment link and online tool so that the country readiness can be assessed, and the feedback from that fed into the compilation of the gaps and was an input into trying to get some form of granular costings for the plan. So we then accumulated this and had technical inputs from all the pillars, including assessments of what HR needs, supplies and resource needs, and then finally compilation and review. So this is just a quick look at the dengue country readiness online checklist. Many of you have seen this form because the data was actually from your countries. This on the top left, you see that this is the data collection environment. It's in Portuguese, English, and French. It's quite an extensive form, but it gives us the advantage of doing an analysis quickly as compared to initial forms that we used to send to member states that were in Excel checklist format. This was administered on member states, and this gave us a broad picture of which capabilities for readiness were missing and which were present in some member states, and were able to sort scores per pillar. On the bottom left, you can see the environment of the dashboard, and 26 out of the 47 member states had filled and updated. This is the operating environment of the dashboard, and it gives us a view. I believe only one member state had developed capacity, while the other two were moderate or limited. Since this presentation is not specifically about this form, I just show a quick overview of what the dashboard looks like. And this on the bottom left is the analysis per pillar comparing member states. We're working on being able to allow member states to actually view their data separately from other member states, as we know this is sensitive data. I like to throw in this slide into all presentations. This is an extract from the WHO EOC handbook, just to remind member states of the myriad of planning formats there are, which can span from very high-level national strategies and plans down to non-hazard specific, which are more or less multi-hazard and takes into account all the hazards that are assessed on a risk assessment as high priority, including the STAR or the VRAM. We come down now to when we are sure we're going to have particular hazards, we create contingency plans which are hazard specific. And these are either for infectious disease or non-infectious disease, physical hazards, biological. And when the event actually hits, it comes back to being an incident action plan. The difference between these two is that in this situation, you have mitigation actions and you have steps that you can take based on scenario planning between 72 hours, 72 hours, 2 weeks, and the actual full implementation of your incident action plan. So compilation was done of plans that were in response that are actually for countries in tier 1, which are already having an outbreak, if you remember from our risk categorization. We made estimates for tier 2 plans, and then broader estimates were made based on readiness and preparedness gaps that were analyzed for all 3 tiers, including the tier 3. And then, of course, we use strategic regional control targets to make broader costings for the plan. So the scope of the plan and the vision is actually an Africa region free of dengue and other arboviral diseases. The audience for this OAP is for the African region, which you recall is 47 member states. On our continent, we have both African region and the Eastern Mediterranean region. It's directed at our ministries, national control programs, subnational programs, research organizations, and funders, and other stakeholders, very critical, especially environment and animal control. The goal is to decrease the regional burden of dengue and other arboviral diseases, minimizing their health, economic, and social impacts, and reverse their increasing trend. You recall from our COVID experience that health conditions do not only affect health, they affect the whole of society. So our general objective was to reduce incident rates of dengue and severe dengue. We have 3 broad impact indicators for the regional plan. The first is that the regional average reported incidence reduces by at least 20%. That is 2024 versus the 2027 to 2023 cumulative rate. Impact indicator 2 is to achieve low case incidence below 100 per 100,000 population by the end of year 2024. The third big impact indicator, and we have to work really hard to achieve, is to reduce and maintain a low case fatality rate below 0.2 by end of year 2024. What are the guiding principles of our regional operational plan? This is guided by, of course, pushing for strong country leadership and ownership. As we're going to be hearing from many of the colleagues, community ownership and community engagement is critical towards ending any disease. You agree with me that every outbreak starts in a community and becomes bigger as it snowballs. We are trying to ensure that multi-sectoral coordination and collaboration is ensured. Health service and health system strengthening must be done. And of course, based on our COVID experience, a whole of society and a people-centered approach is strongly encouraged. So, of course, you can see on the right some of the frameworks that guide what we do, and that includes the International Health Regulations 2005 and the WHO Emergency Response Framework version 2.1. On the bottom left, however, you can see the intersection of our health system and, as I mentioned earlier, multi-sectoralism. You can see that agriculture, economics, social welfare, environment, very important, and of course, human and disaster management are key. Within our new, fairly recent WHO's HEPR, that is Health Emergency Prevention, Preparedness, Response, and Resilience framework. The HEPR is, as I said, a bit newer, and it has this 5 C's component, and it helps to guide our planning process. On the left, you can see the components in the HEPR that speak to what our planning pillars are. So the first C is coordination, strengthening workforce capacity for health emergencies, strengthening health preparedness, health emergency alert and response coordination. The second C, collaborative surveillance. So strong integrated disease threat and vulnerability surveillance, effective diagnostics, being able to actually confirm that there are the disease in multiple countries, collaborative approaches for event detection, risk assessment, and response monitoring. The third C is very important for today's discussions, community engagement, risk communications, and very importantly in this era, infodemic management. Population and environmental public health interventions, multi-sectoral action is key for social and economic protection. Safe and scalable care talks more to our in-facility clinical care, protection of health workers and patients and maintenance, especially of essential health services. We don't want the burden and excess morbidity that comes from a disease that is so widespread to overburden health systems. Finally, in disease, but not least by any means, is the access to countermeasures. So we talk about fast-tracking research and development, scalable manufacturing platforms, coordinated supply chains, and emergency distribution, especially of innovative drugs and devices. So this translates to the right-hand side to pillars you may be more familiar with from the IMS structure, leadership and coordination, but that is broken into leadership and also prevention of sexual exploitation, abuse, and harassment. Risk communications and community engagement, pillar 2. Pillar 3 is surveillance, case investigation, and contact tracing. Preparedness and readiness, pillar 4. Laboratory and laboratory systems, 5. 6A, very important, vector control, speaks to our multi-sectoral collaboration with environment and agricultural services. 6B
2 minutes left, Dr. Ibrahim. 2 minutes left.
Wonderful. I'm about to round up. So clinical management, therapeutics, OSL, continuity of essential services. So this on the right, you're not going to be able to see, but there's about 94 actions and sub-actions that go into the plan. The plan will be definitely circulated through Dr. John. So what have we been able to do? We've been able to categorize, as you heard in the first day, the countries according to tiers. And you can see in this column what is required from countries. In tier 1, of course, they're already in outbreak, so they need to apply response actions and application of the operational requirements. When we're sending out the Excel, the online dashboard link, we also sent anticipatory actions. You see recommended readiness actions here because you agree with me that not every region or county has the outbreak at the same time. So while some are in response, the others are actually meant to be improving readiness. On this tier 2 is countries now that are also supposed to be improving readiness actions according to the anticipatory actions. Tier 3 are supposed to be ensuring they have those minimum capabilities and ensuring that they continuously do risk monitoring and assessment. This is akin to watch mode in EOC. All tiers, of course, we're supposed to be strengthening strategic control measures. So overall, the plan is a very modest plan of about $8.8 million for the region. This is, I must say, one of the most conservative regional control plans. On the right, you'll see the same amount distributed as per pillar, and the operational period is January to December 2024. So far, so good. We have, as a region, been able to mobilize 1.2 million. So it shows that there's still quite a large gap, and this plan is continuously going to be used to be mobilized. But encouragement to member states to also internally resource mobilize, as this plan is supportive of member state response plans, but member state response plans are actually a broader category of plan that would be necessary to achieve control. I want to thank you. There's all of our documents that we use for references, which you've heard probably in previous presentations. I'm sure through the incident manager, you'll be able to have access to the regional operational action plan for dengue. Thank you. I hand back to you, Dr. John.
Thank you so much, Dr. Ibrahim. We'll be having the Q&A session at the end of the webinar. Please go through the Q&A icon and take a look. If there is any question, you can start to answer there. Again, thank you so much, Dr. Ibrahim, for the insight presentation. Let's move forward with Dr. Tammy Allen. If Ibrahim can stop sharing the screen. Dr. Tammy Allen will be discussing about communication for behavioral change. Dr. Tammy Allen, you have the floor and you can open your microphone and video.
Thank you. Can you hear me?
You have 10 minutes.
Sure.
Yeah, we can hear you. Thank you so much.
Great. Thank you. So hi, everyone. My name is Tammy Allen. I'm a public health academic and consultant at James Cook University in Cairns in Australia, and I'm presenting as a member of the WHO Technical Advisory Group for arboviruses. So my training's in health promotion, public health and tropical medicine, and I've been part of outbreak response as a health promotion advisor. So today I'm talking about communication for behaviour change in the context of dengue fever. So just a brief outline, I'm going to be looking at what is communication for behavioural impact for dengue, going to describe really briefly how this fits in with dengue outbreak readiness and response, and then go through some key steps in communication for behavioural impact. So communication for behavioural change or impact is a process that encourages individuals and communities to change their behaviour. So generally speaking, this concept draws on a range of different fields and is a well-documented process developed by the WHO from their COMBI framework. I'm going to be drawing on that framework as well as the fields of health promotion, which is really important, looking at it from a holistic point of view, and also from risk communication, looking at communication as a two-way process. So I just wanted to briefly highlight some of the key characteristics of dengue fever, which makes it really important for us to engage communities in behaviour change. We know that the Aedes aegypti is predominantly a domesticated mosquito now that lives and breeds close to humans. So it's really important that we obviously engage people around their homes and workplaces to help with getting rid of mosquito breeding sites. Dengue fever can have severe health impacts, but you could also have mild or asymptomatic cases, which can make it challenging around finding cases, but also around risk perception. And how people behave can impact, obviously, the start of outbreaks and the control of outbreaks. And we also know that awareness alone as a behaviour change strategy is not often enough to sustain behaviour change. So I just wanted to highlight again where this behavioural and social interventions fits in the key components, or is part of the key components of outbreak response, which we've already talked about as part of this seminar. And I will go into those in a bit more detail. Also wanted to highlight to you this visual representation of an integrated model for emergency risk communication. So anything we do around risk communication or around communication for behaviour change should be part of our initial planning for readiness for outbreaks. And we should be developing and strengthening our communication systems during or in that preparedness phase. Really important part of this cycle is to understand some of the elements around dynamic listening. Well, using dynamic listening to understand some of the rumours and some of the perceptions out there around dengue fever. And this is a cyclical process that continues in that readiness phase and also during outbreak response. So when we're planning for appropriate communication strategies, it's important to firstly identify what are the key, or who are the key people that we want to be involved in this work. So forming a behavioural or risk communication subgroup in that readiness phase, and as was just highlighted in the previous presentation, is really important, and that should be embedded in a broader emergency management system. Identifying who should be on that group and who you should be working with, including community leaders, NGOs and other partners who have the skills and the knowledge to be able to contribute to planning and implementing and evaluating behaviour change strategies is important. Identifying the funds that may be available and the capacity that's required in terms of skill development and training. And also then looking at developing appropriate strategies and piloting them in that readiness phase. So when we're looking at planning these types of strategies, it's important to firstly identify what are the key behaviours that we're wanting people to do at a household level and at a community level in that readiness phase and in the outbreak response. We then need to design community interventions that are feasible, effective, and socially and culturally acceptable, and that we can measure their effectiveness. And we also need to use a variety of strategies. So I'll just go into these in a bit more detail now. So what do we actually want people to do? Here is just some examples of what we would potentially be wanting people to do in that readiness phase and also during outbreak response. So for example, we want to stop the mosquito breeding. And by doing that, we want people to, for example, clean household water storage. In outbreak response, we obviously don't want the mosquito to bite people. So we want people to adopt feasible protective measures that will help to prevent mosquito bites. And we also want people to understand warning signs to look out for and when to seek medical care. So they're just some examples of the types of behaviours that we might be wanting to promote. Okay, so as part of this, we want to be looking at defining some of this as what we call under SMART objectives. So we want to be able to articulate those behaviours in a way that we can measure them. And by doing research, we need to be able to understand what are those behaviours. So if we know that there's a lack of knowledge in the community, we want to have an objective around that. So it might be to increase the amount of people in the community who understand the different types of mosquito breeding sites. If there are barriers identified to getting rid of breeding sites, again, we need to have a clear objective around what we might do to address some of those barriers, particularly in the readiness phase. So how we achieve these objectives is what we do by developing appropriate strategies. So in all of this, we need to make sure that we're using a combination of strategies that are appropriate for different population groups, whether it's for older people, whether it's for schools, whether it's for households. And as part of this process, we want to involve the community as much as possible. So if we're looking at school-based strategies, we should be involving children perhaps in helping to develop strategies, or we're teachers. So when we're thinking about this also, we want to use that combination of strategies. So for example, social mobilisation strategies are particularly useful to address the barriers for people in cleaning up mosquito breeding sites. For example, you might want to look at doing community cleanup events where you have people assisting other people in helping to get rid of breeding sites. You might want to look at strategies such as sustained appropriate advertising with clear, feasible messages, and that address some of those risk perceptions. That's also very important. And you also want to think about those interpersonal communication skills via door-to-door inspections or via door-to-door education. So you do want to involve the community as much as possible in that process. So here are some examples of some communication channels that you might think about using when you're engaging the community. And in all of this, it's really important to understand the appropriateness of those strategies. So when you're going about developing strategies, you need to think about who are you targeting and finding out some of those underlying risk perceptions that are actually impacting perhaps people taking on the behaviour messages that you're giving. So it's important to understand, what do people know about dengue fever? What are their perceptions around susceptibility towards dengue fever? What do they know about signs and symptoms of dengue fever? So we need to find all that information out first. And then when we start to understand some of those community perceptions around dengue fever, then we can start to develop our messaging and choose the appropriate communication channels to communicate those messages. So, for example, if we know that people aren't able to clean up their breeding sites around their homes, or if we know that there's some cultural or social, practices that make it difficult for people to get rid of water storage containers in their homes, say they might use that for cooking, or there might be some cultural barriers for people seeking medical care. We have to look at appropriate communication channels to try and communicate ways to address some of those cultural and social norms. So that might be, as I say, doing door-to-door knocking, where we're actually talking with people about how we can actually address some of those issues, or perhaps use water storage or clean water storage out in a different way. So then they can keep using that water for cooking, for example, but it's actually not contributing to breeding mosquitoes. Other examples you might look at is people who may not have access to medical care. What are some strategies that you might use to try and address some of those barriers? So no one size fits all in terms of the types of strategies that are appropriate to use in any one community. There's a range of different social constructs and specific community elements that are different in every community that you need to understand before you go about developing your messages and before you go about developing these strategies to communicate those messages. So I just wanted to quickly highlight to you some of the important tips, I guess, around public communication, because these are some of the things that can really either make people act on what's being communicated to them or not. So it's really important to obviously use a trusted source when people are communicating. And again, finding that out in that readiness or preparedness phase. Who is it that people listen to? Who is it that people trust? And thinking about who would you have to represent different segments of the population to communicate your messages to. So otherwise, if people don't trust that source, they're not likely to take that information on board. Avoiding mixed messages from different experts is really important. Acting fast, don't wait for rumours to start spreading. So find out, do that dynamic listening and find out what's going on in the community at the time. So risk perception can change. It can change before or in that readiness phase as people start to understand a bit more about what dengue fever is. We know that people's perceptions around severity and susceptibility to a particular disease is important in terms of understanding or their perception around risk and taking on messages. So if they don't think they're at risk, if they don't think getting dengue is going to be a severe disease, or if they don't think that they're susceptible to it, then they may not be likely to take on the messages that you're telling them. So understanding what those risk perceptions are and understanding who are the right people to communicate, addressing some of those or elevating some of those risk perceptions is really important. Being clear about the threat of dengue fever, so understanding what that threat is to begin with, and that threat might change over time. So communicating that clearly and addressing any rumours or misinformation and that irrational fear that might come is really important when you're giving public communication messages. So messaging will be different depending on what stage of the outbreak it is. So I just wanted to summarise. I'm not sure how I'm going for time.
You are at the end. You can proceed, please.
So I just wanted to summarise that planning strategies is very important before an outbreak occurs. During that time, it's really important to understand the community's perceptions around dengue fever, their understanding of breeding sites, their understanding of risk, of susceptibility to dengue fever, of the severity around it. So identifying all of that in the planning stages will help you in developing your objectives that will address perhaps some of the misconceptions, elevate risk, or address some of the barriers that people have to some of those behaviours that I talked about at the start. So identifying risk reduction behaviours, what do you want people to do? What are the barriers to people doing it? Understanding that each community is different. So what is going on in your community might be different to what strategies you use might be different to what strategies are used in a different community. Tailoring your objectives so you can evaluate those objectives so you know whether you've actually increased awareness or whether you've actually addressed barriers to behaviour change. using a variety of strategies, and those strategies will be dependent on the target group and also where people get their information from and who they trust. And I didn't talk about this too much, but evaluating everything you do is really important. So pilot testing any resources you might have before you actually use them, talking to the community the whole way along, involving the community in the development of your strategies is really important, which is why I haven't given a prescriptive list of which strategies to use. Talking to your community, they will be the ones who will know and understand the strategies that will work for them. That's it. Thank you.
Thank you so much, Temi, Alan. It was really interesting, really insight. I think we'll be having a lot of questions from your presentation, and I will encourage you, please, to take a look on Q&A icon. You may already have some questions, so you can start answering. But if you want to respond to one of the questions can be for general interest, please raise your hand at the end of the session, and I will be giving you the floor to summarize key messages from your presentation. Let's quickly move forward with Aziza Amina, who will be sharing with us experience from the field. And we will be starting from experience from Gambia on risk communication committee engagement for dengue in Gambia. Aziza Amina, thank you so much for joining us. You have 10 minutes. Please unmute your microphone and open your video. You have the floor.
Thank you, Dr. John. Good afternoon, colleagues. I am Aziza Amina Said, and I'll be presenting on risk communication and community engagement in the context of dengue preparedness and country experience. I would like to confirm if I'm audible, please. Can you hear me?
Perfect. We can hear you and we can see your slide as well. Thank you.
My presentation outline, I'll be looking at a quick reminders on what we've learned for the past 4 days, the importance of risk communication in the context of dengue preparedness and outbreak response, why we do risk communication before, during, and after emergency and outbreak response, our key strategies we're looking to for dengue preparedness, a sample case studies on a successful initiative we conducted at country level, the challenges we face at country level as risk communication team, and we also come up with solutions to mitigate these challenges, a call for action to member states for dengue preparedness and response. I will not bore you all with the point on our quick reminders, but as risk communication team, we always lay emphasis when we go out there to meet our targeted audience or the community members to advise and encourage them to look out for the symptoms and signs of a particular disease, especially for dengue. That is to say, if they are presenting with high fever, if they are having severe headache, if they are having joint pain, and joint and bone pain, and also if they are experiencing rash on the skin, if they are having nausea and vomiting, and also fatigue and weakness in their body, or swallow lymph nodes, they should contact the nearest health facility or inform our community-based mobilizers in the field or our hygiene promoters. Risk communication is an important component, especially in dengue preparedness and response, because it helps to provide accurate information to our individuals and community. It's also helped to utilize effective communication strategies that will convey an holistic information about a particular risk like dengue. And also it provides an essential knowledge and resources to our individuals and community to inform them about their safety measures they should take before, during, and after a crisis like dengue. We should also know that risk communication also helps to reduce panic, confusion, and uncertainty in our community, whilst promoting trust, cooperation from our community members, and resilience among our affected people or community members. In all of these, community engagement is very important for dengue prevention and preparedness because it helps to educate our community members about the dengue transmission and control measures they should take. It's also helped to empower our community to take ownership of their own health, which can lead them to a sustainable effort and reduce the dengue suspected cases by also ease our rumors and misinformation surrounding dengue diseases. We all should be reminded that risk communication is a crucial component for all emergency responses. I've already indicated by other speakers, risk communication integrates into all thematic areas. And we are also one of the core capacity of the international health regulation that is designed to assist countries in implementing public health risk. We all should know that a timely response to an outbreak such as dengue is crucial for several reasons. That is why, as risk communication, our prompt intervention always helps to prevent the spread of the diseases by promoting early detection and response. It also helps to reduce mortality and morbidity through our timely intervention. It also helps to minimize economic impact through the swift response to reduce the duration and severity of a particular disease. So to be precise, dengue. It's also helped to preserve social stability. That is to say, if there is a large scale of outbreak that can lead to social unrest and panic in the community, our intervention always helps to preserve this instability. Sorry, our intervention always helps to preserve and the social instability. We all should know that information sharing is crucial for adjustment of the public health strategies that always be implementing ineffective control measures for dengue preparedness and possible outbreak. Diseases have no respect for borders. That is why timely response to an outbreak like dengue in country can prevent its spread to another country. Our risk communication objective always aimed at educating the public about dengue prevention and control. We conduct holistic and intensify our community engagement in vector control activities. We also enhance our community resilience against dengue possible outbreak. We're looking now at the key risk communication strategies that we have conducted. We leverage through our public awareness campaign by utilizing our existing community structures and community media houses or traditional media houses. We conducted community workshops for our risk communication and community engagement partners and training of health workers and mobilizers who will be going out there in the field. We also leverage on our social media platform for real-time information. We collaborate with our local health authorities, the NGOs, the CSOs, and our community trusted leaders. The school is one of our critical venues for dengue, so we also leverage in the school existing structure. The importance of eliminating breeding sites at schools and at community level was also done. And then community cleanup initiative at schools and at community level was also done. Our implementing feedback is a very essential thing for risk communication, for our continuous improvement on our intervention. The monitoring of our RCC activities intervention on dengue is very important. So at country level, there is a success initiative in a small country in West Africa that faces numerous public health challenges, including the threat of dengue due to its tropical climate and the presence of Aedes mosquitoes. So we try to develop and implement the integrative RCCE strategy that was aimed at controlling and preventing dengue possible outbreak in the country by focusing on our community involvement, inclusion, participation, and public awareness education on dengue preparedness. The key strategies that were implemented was the enhancement of the surveillance system by training our community health workers, including our community mobilizers, hygiene promoters, who identify and report the dengue suspected cases promptly. We also go through the Ministry of Health and Environmental Agency to conduct our nationwide campaign by using the traditional media houses. And this time around, we also involve the social media platform by equipping the social media bloggers who go into the schools and communities to raise awareness about the dengue prevention and control measures. At school level, we're able to team up with the existing school structures, that is to say, the school management committee, who are able to implement the dengue educational programs by teaching the children about the dengue prevention methods and the role they can play in vector control within the school premises. And one of the success activities that was conducted was the mosquito search and destroy campaign at school. And at community level, we also team up with youth groups, the women groups, to conduct regular community-led cleanup days that was organized to remove potential mosquito breeding sites in the community. We also foster collaboration between government agencies and ministries, looking at local trusted leaders, our NGOs and CSOs that are working with community members, and also our international partners that are working on risk communication to facilitate a joint holistic plan for our RCC intervention activities on dengue preparedness and response. Our risk communication outcome help to increase community engagement, participation on dengue preparedness and response. It also helped to enhance our surveillance by quickening our identification of dengue suspected cases. And also it helped to integrate our risk communication that's actually contributed to a measurable decrease in the incidence of dengue diseases, especially in targeted areas, particularly in school-aged children. More so, it's also helped to promote sustainable vector control practices such as environmental and management and biological control. Some of the lessons learned was the success of our strategies in the prevention of dengue and also the promotion of our education and awareness raising. We are critical in the behavior change related to dengue prevention at community level, an integrated approach and combining our surveillance, public education, intensify community engagement and stakeholder collaboration. We are also essential for effective dengue intervention at community level. In conclusion, our country experienced the underscore for the importance of an integrated RCCE strategy that actually managed dengue suspected cases and possible outbreak by engaging community, enhancing surveillance, and fostering collaboration demonstrated that a comprehensive risk communication and community engagement effort could effectively reduce the burden of dengue diseases in the country. In all of what we did as country, we faced with challenges, but we were able to come up with solutions that actually mitigate these challenges. And one of these challenges that always surrounded risk communication is the misinformation and lack of awareness. So we were able to develop and disseminate a clear, accurate, and easily understandable information through our trusted community channels and influencers, including our social media bloggers. Community participation has always been a difficult thing for us, especially when it's surrounding lack of trust in the health authorities. So we foster our partnership with community leaders, our local NGOs and CSOs that are working with the community, and other trusted stakeholders who were able to facilitate intensify community engagement with the tailored communication messages that we work alongside with the local cultures, and all our messages were also translated into the local dialect of the communities. Resource constraints has always been risk communication challenge, so we leverage on our existing community structures and networks so that we'll be able to have funding partners and international organizations and private sectors who are also working on risk communication. Behavior change resistance is also a challenge, so we utilize our behavior change communication strategy, which include the motivational message and social norming that will fit our community context. Access to remote areas and reaching a marginalized population has always been a challenge for risk communication team. So we employ on mobile teams and utilize our local media within the communities, and also employ our volunteers and mobilizers who are also part and familiar of these communities. Sustainable, our RCCE engagement in overtime, especially for dengue, has always been a problem as well. So we encourage community ownership for the prevention effort that will foster a sustainable participation before, during, and after dengue crisis. Risk communication has been doing a lot by evaluating our risk communication impact in every diseases, especially for dengue, has been a challenge. So this time around, we incorporate our M&E component into our risk communication plan and strategy, which will include both qualitative and quantitative method that will assess our impact. Excuse me, sorry. Dr.
Are
John?
you done?
No,
Yes.
please. I'm trying to move the slide.
You have 1 minute left.
Amarachi, I'm trying to move the slide, please. Amarachi, are you there?
Stop sharing and share again. Share it again. It will be, yeah.
Okay.
How
Thank
many
you.
slides you still have?
It's
You are
just
running
two, I
time?
believe. It's just
Okay.
two. Give me a minute, please. It's just two.
Yeah.
Amarachi, are you there?
Yes, I'm here. How would you like me to
Yes.
help?
Can we move after the challenges? Can we move to the next slide after challenges, please?
Okay.
Okay, it's moving now. Okay, so finally, I would like to call on member states. I want to use this opportunity to call on member states present here for us to take a prompt action on dengue preparedness and response at country level by conducting a sustainable analysis that we understand the current status of dengue fever and identify the gaps for a prompt RCC intervention. Our stakeholders, trusted individuals, including our health authorities, community leaders, CSOs, and our mass media platform for a coordinated and holistic RCC strategic plan that will tailor to the local context of our community members, focusing on prevention, symptoms and recognition, and community response on dengue. The implementation of RCC activities through our community structures is important, so that we should leverage our mass media campaign and the distribution of our educational materials that will promote the preventive behavior
Amarachi, can we have the slide?
on RCC activities to adjust the strategies, and improve the engagement.
1 minute, Aziza. Just 1 minute. It should be better to have this slide.
Is
Even you are
the slide not
beyond
sharing?
the time.
Yes, just give us 1 minute to share the slide. Just 1 minute.
1 minute.
Yeah. And Dr. Aziza, if you can activate your camera when you talk, please.
Dr. Tammy Allen, you have 2 questions to address in the Q&A. Please address this question. Dr. Aziza, now it's okay.
Can you see my
Please
slide?
go
Okay.
ahead. You have
Thank you very
1
much.
minute.
Thank you very
You
much.
have
I'm
1
sorry
minute
for
for
the
that.
each. Thank you
Okay.
very much. I'm sorry for the each. As I was saying, I would like to take this opportunity to call on member states to take a prompt action on dengue preparedness and response by conducting a situational analysis that will understand the current status of the dengue diseases and identify gaps for risk communication intervention efforts in the response. We should also engage our stakeholders, including health authorities, communities trusted leaders, our CSOs who are working with the community, and the mass media for a holistic coordinated approach on dengue response. We should also develop a comprehensive risk communication strategy and plan that will tailor to our local context, focusing on the prevention, symptoms recognition, and community response effort for dengue. The implementation of our RCC effort is important. So through our community's existing structures, social media campaigns, and the distribution of educational materials will be important to promote the preventive behaviors on dengue. We should also monitor and evaluate and gather our feedback on RCC impact and leverage on building capacity for a sustainable RCC effort by training our health workers, the partners that are involved in risk communication. Lastly, we all know risk communication has been receiving the least funding whenever we are having response, but I just noticed that we were having a huge sum projected by Dr. Ibrahim, but yet we should continue to advocate for resources that will support our RCC activities and highlight the importance of the dengue prevention and control, including our health authorities. Here are some activities pictures. Okay. I think I've got this each again. Thank you very much, colleagues, for listening. And the activities pictures doesn't want to come up, but we try to engage our school management committee, which includes the teachers, religious leaders, women's group, and youth, and also the orientation of health workers and our risk communication technical working group. Thank you all for listening.
Thank you so much, Aziza Amina Said. It was really, really interesting. I would like to highlight 2 things. One is the way you identify challenges and address those challenges by suggesting some solutions. And we keep in mind also from your presentation, call for action that you share with all member states. This is really encouraging. And please take a look on the chat. You may have a question to address before the Q&A session at the end of the day. Again, thank you for the great experience coming from Gambia and sharing Adrian. Quickly, let's move forward with field experience from Côte d'Ivoire, and we're inviting Dr. Diabaté Kone and Suleiman. It will be Dr. Diabaté Kone for the presentation. Dr. Diabaté, please share your, open your microphone, activate your video and share the screen. You have the floor, you have 10 minutes on sharing experience. Dr. Diabaté, vous pouvez partager votre présentation, ouvrir le micro et activer la vidéo. Dr. Diabaté from Côte d'Ivoire and Suleiman will be presenting in French. So we'll be asking all of you who are trying to have interpretation to go to the interpretation and mute the original audio. So you'll be able to follow interpretation.
Merci John, merci à tous. Je vais commencer par partager mon écran. Et puis, est-ce que vous me percevez?
Oui, mettez en mode présentation, s'il vous plaît.
D'accord.
Merci. Vous avez 10 minutes. Si vous pouvez nous faire gagner du temps, ce sera une bonne chose. Vous avez la parole.
D'accord, d'accord. Cher John, on va y aller. Merci à John, merci à tous et merci à tous ceux qui nous ont succédé. On va commencer d'abord par présenter le contexte épidémiologique à notre niveau, la stratégie de lutte qui a été mise en œuvre. On va également parler de l'analyse socio-environnementale. Et puis, en pareille circonstance, vous savez toujours qu'il y a voilà, la gestion des rumeurs. Quand on parle d'épidémie, cela ne va sans des rumeurs. À côté de cela, on va vous partager les objectifs CREC au niveau de la Côte d'Ivoire et puis les réalisations au niveau de la CREC. Et puis, on va parler également des défis et des difficultés tout au long de la gestion de la dengue ici. Et puis, on va finir par des recommandations. Donc, on va dire qu'au niveau de la Côte d'Ivoire, voilà, la semaine 25, il y a la dernière épidémie de dengue à Abidjan. On parle de la semaine épidémiologique du 25, c'est-à-dire du 19 au 25 janvier 2003. L'épicentre, c'était la direction départementale au niveau santé de Cocody. Et la circonscription la plus touchée était Bingerville. Les zones touchées, on dira tous les districts sanitaires au niveau d'Abidjan, qui totalisent 13 districts sanitaires. À la date du 19 décembre 2023, on a enregistré plus de 300 cas confirmés et puis malheureusement 27 décès enregistrés dans le district autonome d'Abidjan. En termes de sources de vérification de documents, on pourrait parler du site web qui date du 19 décembre 2023. Et en termes de stratégie mise en œuvre, il y a évidemment la surveillance épidémiologique et entomologique, comme vous le savez. Il y a eu également la lutte antivectorielle et puis, bien évidemment, la communication des risques et l'engagement communautaire. Au niveau de l'analyse socio-environnementale, nous pouvons vous présenter quelques résultats qui nous viennent de l'analyse socio-comportementale rapide en la matière. On a constaté voilà ce qu'on pourrait signifier, sinon qualifier de faible connaissance des populations de la dengue. Et puis, il y a la confusion de la dengue et du paludisme parce que voilà, les signes et les symptômes se ressemblent plus ou moins. Il y a aussi l'automédication parce que on assimile la dengue au palu, donc de façon systématique, il y a des populations, sinon des personnes qui présentent des signes de dengue qui s'apparentent pour eux au palu, ont tendance à prendre des médicaments qui pour eux pourraient leur faire passer voilà, de l'état de fièvre à un autre état où ils se sentiraient beaucoup mieux. Et puis les investigations ont permis de mettre en évidence la présence de vecteurs dans plusieurs quartiers du district autonome d'Abidjan, ce qui traduit un niveau de risque épidémique très élevé dans cette zone d'Abidjan. Et puis, comme vous le savez, hein, en termes d'épidémie, il y a toujours des rumeurs autour des épidémies. Ce que nous avons pu enregistrer sur des rumeurs qui revenaient de façon, j'allais dire, récurrente. Ce sont des rumeurs qui portaient sur le doute sur l'efficacité de la pulvérisation parce que c'est ce système-là qui a été voilà, privilégié dans un premier temps ici. Et puis, l'inefficacité des soins de la médecine conventionnelle pour le traitement de la dengue. Et puis, on a aussi les moustiquaires de couleur verte ou bleue sont contaminés par des microbes de la dengue. Tout ça, ça fait partie des rumeurs. La dengue reste une invention pour les intérêts de l'industrie pharmaceutique. Tout ça aussi également fait partie des rumeurs. Et puis, comme je le disais un peu plus haut, voilà, la dengue qui était considérée comme plus ou moins voilà, un palu. Après, c'est des rumeurs allant d'un palu à des inventions pour des firmes pharmaceutiques ou des grandes entreprises pour se faire de l'argent sur le dos de la communauté. Et puis, en termes d'objectifs grecs, voilà, susciter l'implication des dirigeants et des parties prenantes, aussi également des communautés dans la lutte, engager toutes les parties prenantes, y compris les ONG, les collectivités, améliorer la connaissance des populations sur les avantages de la mise en œuvre des mesures de prévention, sur le rôle avant, pendant et après l'intervention, et puis gérer l'infodémie autour de la dengue. Je l'ai dit un peu plus haut, il y a les rumeurs, l'infodémie, il y a énormément voilà, d'informations qu'on a sur la maladie, souvent par méconnaissance, et souvent aussi par, voilà, c'est fait de façon intentionnelle par des personnes pour amplifier, voilà, la rumeur autour de la maladie. Et puis toujours au niveau, voilà, de la CREC, on pourrait qualifier certains, voilà, résultats comme acquis. Le pays aujourd'hui dispose depuis 2018 d'une stratégie nationale CREC sur les 5 zoonoses prioritaires, y compris la dengue. On a également élaboré un plan de riposte intégrant les activités de la GREC en appui aux activités de riposte contre l'épidémie de dengue. Et puis, au niveau de l'engagement communautaire, nous avons tenu plusieurs réunions de sensibilisation de communautés avec l'appui des collectivités, la mairie de Cocody, Bingerville, Koumansi, Yopougon, 13 villes, Abobo et Porgo. Comme je le disais, les 13 districts d'Abidjan étaient touchés. Il y a eu des réunions de sensibilisation au sein de 10 entreprises privées et publiques ayant enregistré des cas de dengue. Il y a eu également l'organisation de visites dans 7479 ménages avec des ASC pour la gestion voilà, des gîtes larvaires. Il y a également rencontre avec les autorités coutumières de 16 villages de Cocody et de Bingerville, épicentre de la dengue. Il y a également rencontre avec les responsabilités de la fêtière des mairies de Côte d'Ivoire, UVIC aussi. Il y a eu également organisation de séances de sensibilisation dans au moins un lieu de culte de chaque commune du district d'Abidjan, c'est-à-dire les 13 districts, au moins un lieu de culte a été visité où il y a eu des séances de sensibilisation à l'endroit des hommes de Dieu. Et puis également, en termes de renforcement de capacité, il y a eu le briefing de 20 journalistes professionnels de médias sur la dengue. Vous savez que les journalistes sont qualifiés de 4e pouvoir, donc ils ont voilà, cette possibilité d'agir sur voilà, j'allais dire la perception de la communauté et puis d'influencer leur manière de faire. Il y a également la formation de 30 volontaires des ONG responsables de Cocody dans la gestion des quartiers sur la connaissance, l'élimination larvaire et les techniques de communication de proximité. Il y a eu également le briefing de 60 speakers en langue nationale sur l'importance. Ici, il faut dire qu'on a voulu mettre l'accent sur la sensibilisation inclusive parce que généralement, les messages sont élaborés et diffusés par moment en français. Et puis, il y a des communautés qui sont laissées pour compte. Donc, ici, on a voulu mettre l'accent sur la sensibilisation inclusive. Donc, des messages élaborés en français, traduits en langue pour que la sensibilisation soit beaucoup plus large. Et puis, au niveau, voilà, la conception de supports de communication, il y a eu production de supports de communication à affiches dépliants, organisation de plateaux télé et radio. Nous avons pris part à des émissions télé et radio. Il y a eu diffusion de spots de sensibilisation radio et télé. Il y a eu diffusion également de messages à travers différentes plateformes digitales, organisation d'un talk santé, c'est-à-dire discussion de groupe via WhatsApp, ayant mobilisé plus de 300 journalistes, des producteurs, productrices d'émissions santé d'environ 175 radios communautaires de l'OMS, Radio Santé de Côte d'Ivoire, donc environ 277 émissions réalisées et diffusées par ce système-là. Et puis, voilà quelques exemples en termes d'affiches, de quelques campagnes qui ont été menées sur les réseaux sociaux. Vous pouvez constater avec moi des affiches dans le cadre de la sensibilisation. Tout ça rentre dans, n'est-ce pas, la droite ligne de la communication publique. On a des dépliants. Vous pouvez constater aussi un aperçu de la campagne au niveau digital qui a été menée. Et puis, on a des défis et difficultés qu'on a pu rencontrer tout au long de la mise en œuvre, sinon de cette campagne au niveau, voilà, de la riposte. Il y a une faible mobilisation des ressources financières. Et puis, au niveau de l'engagement des collectivités, engagement insuffisant au niveau des collectivités, nous avons constaté une insuffisance au niveau voilà, des premiers magistrats de certaines communes, des 13 districts, et puis la gestion de rumeurs, insuffisance également à ce niveau parce qu'on n'a pas pu traiter toutes voilà, les rumeurs qui revenaient, il fallait les traiter et puis faire un feedback dans la communauté. Et pour finir, en termes de recommandations, il faut accroître les ressources de la CREC pour la prévention et la riposte de la dengue, soutenir la CREC lors de l'intensification des campagnes de prévention liées à l'hygiène et l'assainissement. Oui. Appuyer les actions de plaidoyer en vue de mobiliser.
Ça va, tu vas à la maison directement. Okay.
Toutes les parties prenantes en faveur de la gestion de la dengue.
Ça va?
Donc,
oui,
John, voilà ce qu'on a pu concocter pour vous en fonction du temps, bien évidemment, au niveau de la Côte d'Ivoire.
Merci beaucoup, Diabaté. Moussa, pour la brillante présentation. Vous avez déjà une question sur Q&A, priez l'adresser par écrit, et puis nous allons vous donner la parole à la fin pour quelques observations utiles. Mais il manque quelque chose à la présentation. Vous imaginez qu'est-ce qui manque? Le mot Côte d'Ivoire manque dans la présentation. Et la coupe de la CAN que vous avez gagnée, comme ça on saura que l'expérience vient de la Côte d'Ivoire. Et voilà, le grand éléphant présenté, la présentation, les stratégies de communication en ciblant les médias, quatrième pouvoir, c'était assez intéressant comme ceci. Donc, vous pouvez remettre Côte d'Ivoire, nous avons vu l'éléphant, on peut comprendre. Et puis, repartager avec Amachi, on va partager avec tout le monde, mais restez avec nous. Si vous pouvez adresser la question qui vous est sur le chat. Dr. Aziza Amina for Gambia, you have a question in the Q&A. Please address the question in the Q&A. Now we will be having experience coming from Burkina Faso. Burkina Faso is one of the affected country, is the first one, having 75% of cases and 91% of deaths. Burkina Faso successfully contained their, and we are happy to have one of the Burkina Faso representatives, Dr. Watton Rodrigue. Vous avez la parole. Si vous pouvez partager votre présentation, ouvrir le micro et activer la vidéo. In the same time, please, Dr. Diabaté, si vous pouvez stopper de présenter. Can you stop the sharing screen, Dr. Diabaté from Côte d'Ivoire? Comme ça,
D'accord.
vous donnez le
Oui,
ballon,
oui.
pas la coupe, mais le ballon à Burkina.
D'accord.
So we are asking Dr. Diabaté to stop sharing the screen. And then asking Dr. Watan Rodrigue from Burkina Faso to quickly share experience on risk management, risk communication, and community engagement against dengue in Burkina Faso.
Merci, John. Si Dr. Diabaté peut se déconnecter.
Dr. Diabaté, si vous pouvez arrêter de partager la présentation. Dr. Suleiman, priez de nous aider avec Dr. Diabaté. Merci beaucoup. Then let's go with Dr. Watan Rodrigue. He will be presenting in French. So you can switch if you are an English speaker, please switch interpretation. Docteur Rodrigue, vous pouvez
donc, merci à mes
mettre en mode
prédécesseurs
présentation,
d'avoir
please.
ouvert la voie. Je m'en vais faire une présentation sur la CREC pour ce qui est de la riposte contre la dengue au niveau de la région des Hauts-Bassins du Burkina Faso.
Mettez en haute
Donc,
présentation,
je vais
s'il vous
aller...
plaît. Mettez en mode présentation, s'il
déjà
vous
en
plaît.
mode présentation.
Activez la modification. OK, c'est excellent. Vous avez 10 minutes pour ça, Dr. Rodrigue. J'espère que vous allez nous faire gagner le temps. Merci.
J'espère. OK. Donc, comme le plan de présentation était déjà en place, je vais directement dire que nous avons connu une flambée épidémique de dengue à partir de la semaine 29 au niveau de la région des Hauts-Bassins, ce qui a prévalu l'activation du centre de réponse aux urgences sanitaires Chorus au niveau régional avec la nomination d'un gestionnaire d'incidents. Et ainsi, on a pu mettre en place un système de gestion d'incidents avec un plan d'action d'incidents qui s'articulait autour de 5 axes d'intervention, dont la communication des risques et engagements communautaires. Et des activités, en tout cas de CREG, faisaient partie, en tout cas des activités du plan d'action d'incidents et occupaient une place, en tout cas de choix au regard, en tout cas de cette épidémie qui prenait de l'ampleur au niveau de la région des Hauts-Bassins. Donc, pour pouvoir en tout cas donner la bonne information aux populations sur cette flambée épidémique qui faisait vraiment beaucoup de polémiques au tout début de cette épidémie et pouvoir en tout cas amener les populations à adopter des bonnes pratiques favorables pour nous faciliter la riposte et également permettre de déployer toutes les stratégies en matière de communication pour pouvoir faciliter les actions. C'est ainsi que nous avons procédé à des rencontres, dont des plaidoyers avec les leaders au niveau de la communauté. Et on s'est dit qu'il fallait forcément rentrer par les leaders qui, eux, à leur tour, allaient être des ambassadeurs également de la communication pour pouvoir lutter efficacement contre les infox et en tout cas les dérives liées à la communication qu'on voyait de ça à là. C'est ainsi qu'on a pu tenir 11 rencontres de plaidoyer avec l'ensemble, en tout cas des leaders. Et nous avons commencé ces plaidoyers-là avec les hommes et femmes de médias pour leur expliquer un peu la maladie et ce qui est attendu en termes de riposte et surtout eux-mêmes les amener à nous faciliter pour la communication. Ensuite, pour ce qui est proprement dit, voilà, des leaders, nous avons tenu 9 rencontres au niveau régional et également au niveau des districts avec les leaders au niveau communautaire, également les organisations de la société civile, au niveau également des fêtières, des jeunes, des femmes et les tradis praticiens de santé. Et il s'est agi aussi de pouvoir mettre en place une stratégie pour regarder tout ce qui se passait sur les médias ainsi que les réseaux sociaux pour pouvoir identifier les activistes, les blogueurs, les influenceurs, en tout cas ceux qui avaient beaucoup plus d'aura, pour les convier également à une rencontre de plaidoyer et pouvoir en tout cas corriger les dérives en termes de communication qu'on avait. Donc, c'est ainsi que le 13 septembre, on a pu échanger avec les hommes de médias. Après le plaidoyer, on a formé les hommes de médias sur la grecque. Et après, eux aussi, ils se sont déportés sur le terrain et ont en tout cas facilité la communication sur le terrain. Et l'objectif, c'était vraiment aussi au niveau des médias de travailler à regarder tout ce qui était rumeurs, des informations qui vraiment grandissaient et de pouvoir en tout cas apporter les éléments de réponse ici. Donc, le plaidoyer, comme je l'ai dit, a pu toucher l'ensemble des 8 districts sanitaires de notre région et en tout cas, les leaders ont été touchés et par la suite ont également mené des activités au niveau de la communauté. Donc ici, c'est une rencontre qu'on a eue avec des blogueurs, des influenceurs et c'était un plaidoyer et profiter eux-mêmes de former sur la crème étaient même sceptiques par rapport à cette épidémie qui était là en disant que c'était une conspiration. Voilà, on était des ambassadeurs même pour pouvoir relayer la bonne information quand ils ont compris et ils ont surtout compris la dynamique de cette maladie. Et en réalité, nous avons un gros projet au niveau de la région des Hauts-Bassins, un projet qu'on appelle le Target Malaria pour lutter contre le paludisme. Et les gens pensaient que ça avait un lien vraiment avec cette épidémie majeure qu'on avait rencontrée à notre niveau. En termes de stratégie de communication, nous avons également travaillé avec les masses médias. Donc, nous avons travaillé en fait à identifier tous les médias qui pouvaient nous permettre d'avoir une bonne couverture au niveau de la région, que ce soit la presse écrite, la presse télévisuelle, radio, pour pouvoir en tout cas atteindre le maximum également d'auditeurs et partager les informations qu'il faut. Donc, c'est ainsi qu'on a procédé au montage de spots radio qu'on a pu diffuser en 5 langues, qui sont les 5 langues majeures, en tout cas parlées au niveau de la région, et surtout sur le don de sang pour pouvoir faciliter la prise en charge de ceux qui avaient en tout cas besoin de transfusion sanguine. Donc, nous avons identifié, vous savez, au niveau de nos communautés, nous avons des personnes clés dont tout ce qu'ils disent fait foi. Donc, c'est ainsi que les chefs coutumiers, les chefs religieux, donc quand on prend les musulmans, les protestants, et les animistes, les catholiques, nous avons permis à ces leaders coutumiers et religieux d'enregistrer des messages qui étaient régulièrement diffusés au niveau des radios et cela a permis en tout cas aux populations d'avoir la bonne information et de pouvoir en tout cas adhérer à nos stratégies, en tout cas de lutte. Il y a eu également l'animation il y a eu également des émissions radio que nous avons eu à animer sur, en tout cas, la plupart des médias au niveau de la région et également des émissions télé interactives où à partir de la télé, on donnait un certain nombre d'informations, on discutait de thématiques diverses et à partir de plateaux télé, on permettait en même temps aux populations d'appeler et on répondait ainsi à leurs préoccupations. Il y a eu également beaucoup d'interviews qu'on a eu à tenir avec les hommes de médias pour pouvoir, au fur et à mesure, informer les populations sur les activités de riposte, en tout cas qui étaient menées. On a mis également l'accent sur la communication interpersonnelle avec des acteurs clés comme les volontaires nationaux, agents de santé à base communautaire au nombre et également des volontaires de la Croix-Rouge qu'on a initialement formés en grec et qui devraient aller de ménage en ménage. Dans un premier temps, pour pouvoir sensibiliser les populations, dans un second temps, pour identifier et aider les ménages à la destruction des gîtes larvaires et également les questions d'assainissement du cadre de vie, et également assumer cette communication de proximité également au niveau de nos centres de santé pour ce qui est des malades et des accompagnants, afin qu'au sortir même de l'hôpital, les gens puissent avoir les actions qu'il faut pour pouvoir faciliter cette riposte-là. Et également, nous avons pu nous entretenir avec les praticiens de santé pour pouvoir également faire de sorte que les malades qui viennent à leur niveau et qui présentent en tout cas les symptômes de dengue puissent être référés à notre niveau et qu'eux aussi ils soient des ambassadeurs en termes de communication auprès des patients qui viennent chez eux pour qu'ils comprennent. Et également ceux qui faisaient la phytothérapie et qui proposaient un certain nombre de médicaments, nous avons pu en tout cas échanger avec ces promoteurs-là pour les amener également à être des ambassadeurs. Et pour ce qui est de la communication digitale, nous avons utilisé toutes nos pages Facebook, que ce soit au niveau de la direction régionale, que ce soit au niveau des districts. Et nous avons mis à contribution également la direction régionale de la communication des hauts bassins, et qui nous a permis en tout cas de toucher tous les groupes sociaux et réseaux sociaux pour pouvoir en tout cas passer des messages et donner l'information sur ce qui se passait pour cette riposte contre la dengue-là. Et nous avons également donné de la visibilité à toutes les actions majeures que nous déroulons sur le terrain et le point au fur et à mesure des actions de riposte qu'on avait sur le terrain, et ça permettait vraiment aux populations de savoir comment était conduite la riposte, et les gens étaient vraiment favorables à cette manière de faire. C'est ainsi que lors du lancement de la pulvérisation intradomiciliaire, on a pu faire ce lancement-là et faire ça de façon médiatique pour se passer sur tous les organes, en tout cas de presse. Et c'était moi-même en tant que gestionnaire d'incidents. Il y a eu le ministre de la Santé qui était également à Bobo pour le lancement de la pulvérisation spatiale et de même que les journées de salubrité. Et ici, c'est lors du lancement, cette photo c'est lors en tout cas du lancement pour la pulvérisation intradomiciliaire qu'on a commencé dans un centre de santé au niveau de la ville de Bobo-Dioulasso. Et ici, c'est les images pour ce qui est de la pulvérisation spatiale et de la salubrité avec monsieur le ministre. Il y a eu également la mise en œuvre de plusieurs autres actions, que ce soit par le niveau central, donc depuis Ouagadougou, et également au niveau régional en termes de communication sur les radios, les télés. Et nous avons pu également mettre à contribution l'ensemble des plateformes Facebook pour pouvoir suivre les infox et regarder ceux, en tout cas, qui tentaient de décourager les populations ou les amener, en tout cas, à avoir un certain nombre de difficultés. Et également, nous avons produit et diffusé des supports de communication visuelle et également des messages clés qui étaient affichés un peu dans la ville au niveau des lieux de grands rassemblements et également qu'on partageait au niveau des différents groupes WhatsApp que nous avions. Donc, les acquis potentiels de cette communication, c'est que ça nous a permis vraiment de diminuer la demande des tests de diagnostic rapide, parce que c'est une maladie qui fait peur et les populations voulaient vraiment se faire dépister, alors que le test de diagnostic rapide, c'est vraiment pour pouvoir poser le diagnostic. Et quand les gens ont compris, ils ont vraiment arrêté de venir à tout bout de champ dans les hôpitaux pour demander à ce qu'on fasse un dépistage. Et cela nous a permis également de pouvoir maîtriser les questions d'automédication, parce qu'au tout début, beaucoup de ceux qui décédaient étaient des personnes qui faisaient de l'automédication et qui prenaient soit des décoctions ou des médicaments qui étaient contre-indiqués lorsqu'on est positif, en tout cas à la dengue. Et ça nous a permis, au niveau des hôpitaux, de constater une réduction considérable des intoxications médicamenteuses qui conduisaient vers des insuffisances rénales ou hépatiques, ou souvent les deux, ou souvent des défaillances polyviscérales. Et ça nous a permis également, au niveau des centres de santé, d'être débordés, parce qu'avec cette épidémie, la communication a amené vraiment les gens à fréquenter les centres de santé, et les praticiens de santé ont également joué leur rôle et ils nous envoyaient vraiment les cas suspects et pour la prise en charge au niveau des hôpitaux. Et ça a pu vraiment permettre de sauver beaucoup de cas. Et ça a amené également les populations à adopter un comportement qui était favorable à la riposte. Et également au niveau de la communauté, on a senti un engagement pour pouvoir en tout cas reconnaître et détruire les gîtes larvaires qu'il y avait au niveau des concessions. Et depuis lors, les populations s'organisent régulièrement pour pouvoir travailler sur l'assainissement du cadre de vie. Donc, en conclusion, je peux dire que c'était une très belle expérience, cette riposte contre la crève, au cours de cette riposte contre la dengue. Ça a permis vraiment de limiter la propagation, en tout cas de l'épidémie, au niveau de la région des Hauts-Bassins. Mais ça veut dire qu'on a puisé toute cette expérience-là dans la gestion de la pandémie à COVID-19 et le plan en fait, de communication qu'on avait déjà et le plan multirisque qu'on avait. Donc, on savait déjà lorsqu'on est devant telle situation comment faire. Et l'efficacité de la CREG n'est plus à démontrer dans un contexte d'épidémie. Malheureusement, la CREG, ça demande beaucoup de ressources parce que toutes les activités de communication qu'on a eu à faire, même au niveau des médias publics, c'est payant. Malheureusement, il n'y a pas beaucoup de partenaires qui sont vraiment prêts à mettre de l'argent pour ce qui est de la CREG lors des épidémies. Voici, mesdames et messieurs, ce que j'avais à partager avec vous et je vous remercie. J'espère que j'ai pu faire gagner un peu de temps. Merci bien. Allô? J'en ai fini. Merci.
OK, merci à vous, Dr. Rodrigue. John, Dr. John? Yes.
Okay, thank you, everybody. We're so sorry, Dr. John is a little bit unavailable right now. So we're going to go to the Q&A. I see that there are some hands already for questions and answer. Yeah, so we're going to start with, I think there's just one hand. Fureratu, please unmute yourself. You've been given access and ask your questions. Fureratu, Zakari, you have your hands up. If you can please unmute. You have been given access. You can ask your question, please. Fureratu, if you're speaking.
Dr. John is not online. Dr. Emmanuel, are you there? Dr. Chanda?
Can you guys hear me?
Amarachi?
Yes, I am here and I have been speaking. Fureratu, you have been given access. If you still want to ask your question, please. All right. Dachel Eyenet, you have been given access. Please unmute and ask your question. Dachel? Okay, we're going to give priority to our Lusophone speaking participants. If you're Portuguese and you have a question you want to ask, please raise your hands and we will give you access. So we have Claudine. Claudine, please unmute and ask your question.
Hello, can you hear me?
Yes, Claudine, we can hear you.
Okay, thank you very much. I would like to thank our speakers. I have one observation. In his speech last Monday, Dr. John said that it's no longer dengue fever, but only dengue. But in their speeches, some speakers keep saying dengue fever. What's really going on? Maybe I have misunderstood, you never know. Please tell me more about it. Thank you very much.
Dr. Chanda, Emmanuel, would you like to take this? Emmanuel Chanda, can you take this?
Sorry, I missed the question. If it could just be repeated, please.
Claudine is asking why it is no longer referred to as dengue fever and just dengue. Emmanuel, can you respond?
I think John is back. He's likely to take that one.
Yeah, thank
you.
John, thank you for joining us. Just quickly, we have a question from Claudine. Claudine wants to know why it is no longer referred to as dengue fever and why it is now called just dengue.
Thank you for the question. I would like to clarify that what is recommended is dengue and not dengue fever, as we said last time during the meeting. Why? Because in 40%, up to 40%, we don't have sign. We have, patients who are infected are asymptomatic. So if you can take a look on what we are publishing in terms of communication at WHO Afro, we are referring to dengue, not dengue fever, because dengue fever is not, may be missing, and we may not be able to suspect and to lose the case. So to make it easy, let's talk about dengue. The disease is dengue and not dengue fever. It's like in Ebola. We're talking about viral hemorrhagic fever. Now it's Ebola disease. So now it's dengue disease, and let's stop trying to share a bad message by talking about dengue fever, because fever may be missing and it may be presented bleeding on the other severe and warning sign, and we'll be just looking for fever. So this is the message in short. Thank you.
Okay, thank you, John. Suleiman, you have been given permission to talk. Please go ahead and ask your question now. Suleiman Yusuf Ali.
Okay, thank you very much. This is a very important thing. So my question is, the dengue disease, can we have a vaccination to protect it, to prevent this disease? Thank you very much.
Suleiman, and just before the panelists attend to that, Barry Yahya, over to you, please. Barry Yahya, you have been given permission to unmute.
Oui. Oh, merci. Merci beaucoup. Bonjour tout le monde. Merci. Moi, j'aimerais savoir par rapport à l'immunité de la dengue avec avec un de ces sérotypes. Est-ce que si on guérit de la dengue, est-ce qu'on peut être immunisé pour combien de temps, par exemple? Merci beaucoup.
Thank you so much, Yaya. And there was somebody else. If you could please go straight to the point. Sultan, you have been given permission. Please go straight to the point. Sultan and Al-Nakli, are you there? Please ask your question. All right. John, I think you should take the last two. John, is he with us? Okay. Can somebody jump in, please? Tammy, is there vaccination for dengue? According to the question, anybody can jump in. Tammy, yeah.
I think there's some in the late stages of development, and I think in some countries they're starting to, start my video, sorry. Yeah. There's no dengue vaccination widely available at the moment, but there are some in the late stages of development that are going to be available in some countries.
Okay. Thank you so much, Tammy. Dr. Teble, if you're with us, can you attend to the French question if you're with us? Teble? All right, colleagues, following the absence of any other questions, I would like to call the meeting to a close. Thank you so much for staying with us. And we know that it is a Friday. We bid you good Jumat for our Muslim brothers and sisters and a nice weekend to those of us who are not Muslim. Please, should you have any questions for any of the panelists, I will be sending you follow-up messages with some of the presentations and the resource materials that the panelists are making available to you. Should you need any further clarification with any of the panelists, please send me an email and I will put you in contact with them. Thank you for sticking with us throughout the series, and we hope that this has helped in your professional development and in your work. So bye everybody. Have a nice weekend.
Thank you.